In tonight's Health Check, a new and less invasive way to perform back surgery. A lot of people want to hear about this. 9 News Now anchor and health reporter Tracy Neal is here to spill it all.
That's right, especially when you say less invasive. When we talk about back surgery. Okay, if you suffer from back pain and you are considering surgery, we have a story that you need to check out here. Georgetown University Hospital is now doing a procedure that involves smaller incisions, less blood loss, and as you are about to see tonight, less time on the mend.
My goal is to play with my grandchildren.
One look at Mildred Birch-Dennis, and it's obvious she is in no condition to do much. After walking just a few yards, she has to grab a hold of some relief.
I feel 90 years old. My doctor said I had the back of an 80-year-old.
This is Mildred's 50-year-old back. It's filled with hardware from past surgeries and a spinal cord stimulator. But Mildred is still in excruciating pain. So she's come to Georgetown University Hospital for a new procedure called XLIF. Her surgeon is Dr. Fahim Sandhu.
It's an extreme lateral inner body fusion, and I'm coming in from the side.
You heard him right. Back surgery from the side of Mildred's body. Dr. Sandhu will make a 4-inch incision, thus cutting through less muscle than if he went through her back. He'll remove Mildred's damaged disc and then put in a spacer to level off her vertebrae.
If I had to do this from the previous techniques, I would come from the back, open up her previous incision. There's a lot of scar tissue there. I'd have to take out her previous screws and rods. By coming in from the side, I avoid all of that scar tissue, and I can leave her previous instrumentation alone, and then just focus on this damage level.
The surgery takes a little over an hour, and Mildred's recovery time should only be 4 to 6 weeks versus 6 to 12 months for standard open spine treatment.
It's just an incredible difference.
Lynn Haverty had the XLIF 4 months ago.
I couldn't walk up the steps. I had to crawl up the stairs. Ta-da! Come on, little. Come on, good girl. I can do things that I couldn't do before. Shopping, lunch, restaurants. I can stand up. I can wait in line. I can drive.
All those things we take for granted. Now, the XLIF is only an option for the lumbar region of the back or for abdominal sections of the torso. Dr. Sandhu says patients with back pain near the tailbone are not good candidates because of the hip bone. As for Mildred, we checked in with her today, 1 week after her surgery, and she is back at work. Isn't that remarkable? As a teacher's assistant. She says she has no pain at all, and she is walking straight, not all hunched over, as you saw her doing before. If you'd like more information on the XLIF, just go to our website, WUSA9.com, and click on the news tab. Scroll down to health. Now, you had a couple of wows in that story, but it is pretty remarkable.
It is
right?
amazing because I know someone who had back surgery, and it does take the better part of a year to get better.
Not
so
anymore.
for something like this, wow.
Yeah.
All right. Well, Derek, we'll send it over to you.
I'm impressed as well. That was something. All right. 9 News Now at 6 o'clock, now about 15 minutes away, and Anchor Todd...